So in biology, we talked about the structure of the spine, and you have the vertebra, and then you also have the intervertebral discs in between. And this is composed of two layers. The outer layer of the disc is called the annulus fibrosus, and it's a tough fibrous layer. And then the inner portion is softer and spongier, and it's called the nucleus pulposus. And when you have a herniated disc, what happens is the annulus fibrosus tears or weakens, and then the nucleus pulposus herniates or slips out of the area it's supposed to be in. And this puts pressure on the spinal cord and or the nerves in the spine. And then, as you can see, we know that there's different portions of the spine, and 90% of herniations usually occur in the lumbar or the lumbosacral region. 8% are in the cervical, and then the 1 to 2% that's left are typically in the thoracic area. So symptoms and assessment, when you first go in to have those looked at, they're going to look at your history of back pain, including the location and the intensity of the pain. They're going to look to see if your symptoms have gradually progressed over days or weeks. This shows the increasing pressure that might be put on your spinal cord or the nerves. It's also important to look at the development and distribution of extremity pain. This can help tell them where in your spine if you do have a herniated disc. The most common symptom of a herniated disc is pain exacerbated by activity, so lifting things. It's also, you're supposed to ask if pain intensifies with coughing or sneezing or bending. It's really important to ask about weakness in extremities because it could worsen and cause other important issues. Some of the causes of a herniated disc, we see that it's pretty common in people who have a history of back pain, although you don't have to have a history of back pain to have a herniated disc. It's really common in heavy physical labor, which is like repetitive bending, twisting, or heavy lifting. This can also be caused because your abdominal wall muscles and your back muscles aren't strong enough to support your spine. So when you do bend or lift something heavy, all the stress is put on your spine and your discs, which causes it to herniate. And then age also produces weakness and dryness in the disc and fragility in the annulus fibrosus, which obviously increases the likelihood of injury. When you go in, the nursing diagnosis from the DMD book is pain acute related to inflammation and compression. And the two tests that they'll usually do to diagnose you are the magnetic resonance imaging or an MRI. This shows the bony and the soft tissue deterioration, and it shows changes in the spinal structure and the alignment, and the deterioration of the herniation or the soft tissue. And this is really important because it shows the soft tissue, so it can show, as you can see here, this is like the herniation, and all the other ones, there's no little bulge. Something else they can do is an x-ray, and this obviously shows the bony structures, and it can show any variation in the bony structures or variation in the alignment of your spine, which is obviously important. So treatment, there are a couple different things. Obviously, pharmacology to regulate your symptoms like pain. Physical therapy can be really helpful. Things like passive modalities including heat, icing, massage. They can use ultrasound and electrogalvanic stimulation to help reduce pain, and then exercise to stretch and strengthen the spine to prevent further injury. Something else that you can do is spinal adjustments through chiropractics. And then something they do, it's called chemonucleolysis, which is when it's the top picture over here, and they inject an enzyme called chymopathy into the nucleus pulposus. And what this does is it's attempting to dissolve the nucleus pulposus to relieve the pressure, because in the herniation, this is what comes out of the annulus fibrosus to put pain. So if they get rid of the fluid, then it's not going to cause pressure on your nerves. And then what we talked in class, we talked about the laminectomy, which is when they remove the lamina of the spine, which is on the opposite side of where the disc is putting pressure, so the nerve is allowed to move out so that there's still pressure, but it's not causing pain. So prognosis and follow-up. It's really important to teach the patient about the mechanics of dysfunction and how the herniation occurs. This can prevent further injury, and it's also important to teach them about body mechanics since the main cause of a herniated disc is lifting or moving something heavy. It's important to teach them about avoiding high torsion activities, so like twisting or twisting while lifting something heavy. So we talked about how PT can be used to help, but it's also important to have an exercise program after to strengthen the abdominal wall muscles and your back muscles, because it will prevent more injury. Because if you have the support that you need in your abdominal and in your back, then the strain's not going to be put on your spine when you're lifting things. And then obviously as nurses, you need to make sure that the patient understands any medications prescribed, like when to take it, the dosage they have, any actions they need to take, and side effects. And it's also important to tell them not to use any heavy machinery or anything like that, because it's likely to impair their judgment.